So our next speaker is Andrew Bledsoe. We're going to stay on the same topic of social determinants of health. And Andrew is the Deputy Executive Director, State HIT Coordinator at the Office of Health Data and Analytics at KHIE. His current appointment as State HIT Director and Deputy Executive Director of the Office of Health and Data Analytics within the Cabinet for Health and Family Services primarily focuses on implementing the KHIE strategic plan and operational plan, promoting the statewide exchange of patient health information, spearheading a number of new services designed to improve care coordination and offer new avenues to reduce reporting burdens and foster interagency collaboration. You really have a long title, Andrew. So, and it's really difficult to say. Your name tag is probably pretty long.
Yeah, my name tag, it actually unfolds, so I can get all that on there. Thank you, Brent. Well, I'm so excited to get to be here, especially after that presentation. Trudy did such a phenomenal job talking about social determinants of health and helping to kind of give us a lot of context around that and why it's important, and really specifically how UK is using it. It was really hard for me not to jump up during the question and answer portion because a lot of these questions were so perfectly describing actually what I'm going to talk to you about today. So I was having to hold myself down in the chair. So this is very exciting for me. This is what we're going to talk about today. We're going to be really quick over KHIE. I know I see many familiar faces in here, maybe a few new faces, so I won't spend too much time there. But we're really going to talk about the work that we are doing within KHIE and really within the broader cabinet on social determinants of health. And one of those is Kynect resources, which I think you'll be excited to hear about. As he mentioned, I'm Andrew Bledsoe with the Cabinet for Health and Family Services, Deputy Executive Director, all that. You already heard that. But what's really interesting here is the Kentucky Health Information Exchange is a health information exchange that's housed completely within state government. This is very unique. And if you've ever heard me talk, you've heard me talk about this a million times. But every day that I'm in this space and I talk to other states and I talk to other communities, it just reminds me how uniquely positioned we are, but how beneficial this is for all of you and all of your organizations, because it really enables us a really unprecedented opportunity to collaborate very easily with all of the other agencies within the cabinet. So we're able to work with Medicaid very closely on things like the HRIP measures and social determinants of health and Kynect resources. We're able to work with public health on all the public health initiatives and all the amazing work that they're doing, and anything that we can do to help make their jobs easier, we're so happy to be a part of. We have behavioral health, where we're really diving into a lot of helping to provide important information to the right individuals at the right time to assist with behavioral health across the state. And really many of the other departments, there's so many projects, I could keep going. The Department for Community-Based Services, we do a really neat foster child program that I'd like to talk about maybe at another opportunity, but there's just so many benefits. One of the main benefits, though, is that we are able to continue to offset the expense of the health information exchange so that we do not have to charge you for any of these services. Many of the other HIEs, they charge for the work that they provide you. So you're being charged from your EHR system and you're being charged from your health information exchange. And so this is a major benefit to the Commonwealth, that you're able to have access to everything we're going to talk about today for free. Let's see where we're going. Okay, so again, real quick on the KHIE, just if you've not heard about it, I like to talk about what we're doing as far as exchanging information. So keep in mind, everything we do is bi-directional. So we're reaching out, we're building a network. We have a huge network, and I'll talk about some numbers in a minute, but we need data being contributed to us so that that data is available back to you from other healthcare organizations. So in talking about this data, I like to be somewhat specific so that you understand what is being contributed, so that you know what you would have access to realize benefit from the HIE. So I'm going to actually start over here on types of data. admits, discharge, transfers. This is the basic information about an encounter. This is patient information, patient identifiers, such as address, phone number, all of the important patient identifiers that's important to set that patient up within our system, within our master patient index. But what we find is that information is extremely valuable all the time. We have some users who are using us solely for updated phone numbers and updated addresses, just because we have a more recent and updated information on that than other organizations would. We get provider information, we get claims data in there, we get location within a facility information, lots of information from an ADT. And you'll see within some of the statistics, that's the largest amount of information that we're receiving. Summary CCDs is kind of like that. You're being discharged from an emergency department or you're leaving your encounter. It's that summary of care that says why the patient was seen at your facility today, what was done with them, what were their test results, what medications have been ordered, what are they supposed to do when they go home. A CCD is just that, essentially in an electronic format. And so we have that from individual encounters, but we also combine that together to have one complete and comprehensive summary CCD on a patient. We reflect all of the Medicaid paid claims within our system. And so there's a lot of meaty and robust information that we can receive from that information. Social determinants of health we'll talk about, pathology results, public health data, medications and allergies. There's a long list of things here, but these are some of the most common elements that you could expect to see. And some of the sources of those: hospitals, we have ambulatory outpatient clinics, we have behavioral health centers, FQHCs, a lot of pharmacies, and interestingly, the ambulance system sending us all of their run sheets. So we have a lot of information that we're excited to be giving to you. A little bit of information. I love talking about this because this is fairly new. We now have 100% of the hospitals in Kentucky sending information into the HIE. So this is a big deal because what this, oh, yeah, thank you. Yep. What this means is that if your patients are being seen within a hospital in the state of Kentucky, we know about it and we can give you that information. This is, none of the other health information exchanges across the country have this level of access to information. They do not have 100% of the hospitals in their region. So again, this is really unprecedented and huge for the state. A little bit just for you guys to understand the size and the amount of data that we have. We have 18,000 data feeds for points of care across the state sending us information. We have I was talking about ADTs being so important. In September of 2023, we had 19.4 million of those sent into the Health Information Exchange. That's a lot of information. So we have a lot of data that we can provide back to you. We received 240,000 electronic case reports. That's a big program that we're facilitating for public health right now. And that's 240,000 case reports that did not have to be manually filled out on an EPED form and faxed in and manually input into the NED system. And then we delivered just under 1 million event notifications last month. So lots of information that we're sharing. And ways to engage with us. What we're really focusing on right now is being very intentional and trying to put this information into the hands of the right individuals within an organization. And so the ways that we've done that is we've built an ambassador network. And through this network, we have a cohort model approach to where we're doing a train the trainer. So it's a 12-week program. We meet every other week. And within those sessions, we do deep dives into specific components of our system. And then those individuals become advocates for their organizations because we found that they know who within their organization would need to have access to our systems more than we would know. And so we've been working really hard to get this in front of the right people. Social Determinants of Health Discovery Labs. So everything we're going to talk about today in just a few minutes, we expand upon that in a full day approach. And so we talk a lot about why social determinants of health is important, how our systems can benefit them, and then we have hands-on activities. We do a lot of webinars, and we are planning towards a 2024 eHealth Summit. So just ways that we do some engagement. Now, this is a list of all of our services. I'm not going to go through this because we could spend the better part of 3 days together going through this. So we're going to focus on social determinants of health today. So why is social determinants of health important, and why do you all keep hearing me talk about this? Trudy, again, done a great job giving introduction and deep discussion on this. So a lot of these points are very similar, but it's that influence on the health outcomes. You know, we now know that these factors that are contributors for social determinants of health play such a large role in an individual's overall and entire well-being. The health inequities. So the marginalized and the underserved communities are disproportionately affected by social determinants of health. So identifying those, advocating for them, working with those community-based organizations is very important. Preventative care, so addressing these social determinants of health can help really move the needle on preventative care. And I think we all know how important preventative care is. If we can catch things early, it certainly saves a lot of issues on the backside. And then that patient-centered care approach. So in a survey of clinicians from 2022, 60% of those clinicians surveyed said that they do not have adequate resources to address social determinants of health. One of these is the lack of community resources available. So we were just talking about how this is something we're going to be faced with as we're all working to kind of capture this now through the assessment process. But this shows that that problem is already happening. Another is the limited time with patients to understand the full picture. And so we know that the amount of time that clinicians, nursing staff, really anyone, is very limited, and they're being asked to do multiple things now. Now, again, as we've talked, this is important. This has major downstream implications for an individual's whole person health. And so incorporating that in a positive way through change management. And then not enough information about community resources. Time and time again, you know, I work with communities, work with facilities, and just down the street from them is a food bank or someone offering educational programs. But the healthcare organizations and the individuals talking about social determinants of health may not know about that resource. So it's really hard for them to have that information out there. And then looking across, you know, broadly the state of Kentucky, while it's not great, it's better than it is. And we do have some great measures that we're looking at for the state of Kentucky, like physical environment. We are 15th out of the states for physical environment. I think that's pretty good. Rather than focusing on all of the ones where we're 48, we like to have some positives and share the successes that we've had. So we've really moved the needle there over the last couple of years. Clinical care, 31st. So again, that's pretty significant. But then we start getting into these health behaviors and social and economic factors where we're at 46 and 39 respectively. And so this is from America's Health Rankings from 2022. And so this is really showing us why social determinants of health is important and why we need to be focusing on it and why we're really talking about it so much. Love this per county health rankings, talking about how much clinical care plays a part in an overall well-being of an individual. And you can see that again, that 80% really comes from these other areas, with 40 and 30 being that social and economic factors and health behaviors. Again, this is why it's so important. Within the Cabinet for Health and Family Services, we have 2 technology programs that we have worked to coordinate and collaborate to bring together to help address social determinants of health. So we've talked a lot about KHIE, so we kind of broadly know what KHIE is doing. We connect to EHR systems and we transmit that data from one facility or one system to another. And so what we've done is we've leveraged that to start capturing social determinants of health information. So what we're doing is, as patients are, we're kind of taking a 3-step approach: the evaluate, standardize, and display, and then refer. So as patients are being seen and being treated in these healthcare facilities, And as you all are starting to conduct these assessments, you're performing that evaluation. If that information is captured electronically in the EHR and it's coded, that can then be sent to us at KHIE. And so that's when we're starting to standardize that information, and we're presenting that information within our system. So if that's been sent to us, we can present social determinants of health information within all of the KHIE systems. So within our web-based portal, within our integration systems, we demonstrate and show you if there is a known social determinant of health for that patient. And then we refer over to Kynect resources, which is what we're going to talk about in a minute. So Kynect resources, actually, I'm going to back up. Kynect resources first is a resource engine that the state has developed to help log and manage all of the resources that are available from those community-based organizations. So this was developed again within the cabinet and is being promoted across the entirety of the state. That system has two primary goals. One is conducting an assessment. So while some of the EHR systems are very sophisticated and can build assessments within the technology, not all of them are. And especially as more of the ambulatory systems are starting to get into the assessment phase. So Kynect resources can actually allow you to complete that assessment within their system. And then it creates that referral to the community-based organization that has logged that resource that they have available. So I'll go through a little bit of a workflow and what that looks like in just a minute. So we have these two different systems. So KHIE, we're capturing information that can be through the ICD-10 Z codes, or that can be through LOINC codes on a results message. So there's a couple different ways. The LOINC codes on a results message is actually the ideal way, because that is, if you are building an assessment within your EHR, a lot of the times you can, on the back side of that, automatically build the codes to be associated with the questions, so that as that you are completing the assessment, that message is already being developed in the background, and it's going to come to us at KHIE automatically. With the ICD-10, there is some opportunities to do the same type of a setup, but most of the time we see that as being kind of subsequently being added on to the claim. And so it's a little more delayed coming into us, depending upon when that has been completed by the healthcare facility. But we have social determinants of health information that's currently being sent to us. Also, we're receiving quite a bit of those from Medicaid. So the Medicaid program has been receiving SDoH ICD-10 Z codes for quite some time. And since we populate our system with a lot of Medicaid data, we already have a robust amount of information in there. Kynect resources is also completing assessments. So you can log in and you can answer the 18 questions. A patient can do this themselves. A representative can do this with a patient. And so they have SDoH information, but we need both of those to go back and forth. So what we have done is we've built a technology connection between the two systems that is a bidirectional flow of information. So we send, when we know that an individual has social determinants of health, we make that available to Kynect resources. So if someone is working with a patient, they can log into Kynect resources and they may already have SDoHs logged for them. So they can immediately start working with that patient and matching them to the resources that are needed. And similarly, Kynect resources knows if a patient has a social determinant of health, if they have completed an assessment. That assessment information is sent to us, so that's included as we reflect this information to the clinical population. So this is very important, because if you are using KHIE and you are looking up a patient that you're working with and you see that they have transportation insecurity, you already know that if you refer them, let's say from Hazard up to Lexington or Louisville to a specialist, that's going to be a problem for them. And so we're able to reflect all of that information up front so that you guys can know that. In order to do that, we had to standardize the process so that we were all talking the same language. Let's see. Yeah. And so we used a red, yellow, and green status to match to 18 SDoH identifiers that we have identified as the cabinet's priority identifiers. Then we went out and we looked at every ICD-10, every LOINC code, and we matched them to that 18 identifiers, and then gave it a red, yellow, or green status, so that as those codes are coming into us, they're automatically going to be associated. Like, let's say one comes in as childcare. So we'll know that this code, I don't know, 22904, whatever, 22904 is coming into us. We recognize that as being a childcare code for the social determinant of health. And we have that marked because of the answer that it's a yellow status on the patient. So all of that is fully automated. And we have, between both systems, matched all of the information, the questions, the identifiers, to that same 18 identifiers and the red, yellow, and green status, so that we're all talking the same language. That's very important. And we matched all of the assessments that we could find to this. So any assessment you could throw at me, we have taken all of the questions and we've matched it to this. And that's something that we can continually adapt to as questions evolve. So Kynect Resources, a little more about this. Kynect Resources was built to be that resource engine for the state, because we've been hearing for quite a while that there are these community-based organizations that nobody knows about. And how do you refer to them? And then let's build an electronic format and mechanism to be able to facilitate this. And so it was built to be able to be that referral loop system to help aid those community-based organizations and healthcare. We have an interface with United Way with the 211 system. So that was an immediate burst of resources across the state. And also all of the calls that are coming into 211 are being referred into our system as well. And so all of that is being logged within the Kynect Resources. So integrated eligibility and enrollment is also wrapped in there. So depending upon how an individual answers those questions, it may make them eligible for some of the services that the cabinet and Medicaid has to offer. KHIE, we talked a little bit about that connection. And then all of the community-based organizations are able to build a profile, create users that would receive those referrals and log their resources as available. This is what an individual's profile would look like on here. So you can see that they have the basic information, the programs that they're already enrolled in, their household information, previous assessments, and then it's got like a quick view right here at all of their risk factors. This shows, that demonstrates the red, yellow, and green status, and so kind of how that is distributed there. And if you want more information on that, here's our the website for Kynect Resources, and Tracy Williams is the executive director of that program and loves to speak to groups and would love to talk to anyone. Now, okay, so let's talk about, we've got these two systems. I'm going to try to walk through a real life scenario here. So we have Lib Bindle. Lib lives in Louisville and he has severe asthma. And Lib lacks appropriate access to health services because of their financial status. And so this means that they're unable to travel for their locally healthcare, to their local healthcare facilities for their regular checkups. So a lot of the times what ends up happening because of that financial instability, they have to make decisions between buying food and asthma medication. Well, because they chose food, they've had an asthma flare-up and they've had to go to the hospital. So Lib shows up to the emergency department as part of being evaluated. They put in there, they complete a social determinants of health screening, or they've coded that there are social determinants of health, and that information is being sent to us automatically into KHIE. And so then we can standardize against that red, yellow, and green status, the 18 identifiers, and we can reflect that for Lib. So then LIB, let's say they're discharged. They go to their primary care provider. The primary care provider logs into KHIE and can see that LIB was in the ER and ended up in the ER through the conversation because of the financial instability, and they weren't able to go to their primary care provider. So then the case manager, the care coordinator at that primary care facility is able to work to match LIB with resources through Kynect resources. That's kind of a real life scenario how the two systems work together. But even more, so what we've done is, because we do have these two separate systems, we've worked to make it easy to go back and forth between them. So this is a look at the KHIE Partner Viewer. This is our web-based portal that you would log into to access clinical information. So you search for the patient you're working on. So we would look up LIB Bindle, pull them up, it shows all the clinical information. And I know it's small, but there is an SDoH tab right here. You click on that SDoH tab, you get two basic areas. This one is all of the individual social determinants of health that has been sent in on that person. So it shows here that on this date, they had a housing insecurity and it was sent by University of Kentucky Healthcare. And then this right here is education. It was sent in from Medicaid. And so it would say Kynect resources here also, if it was assessment information from Kynect resources. So this is every individual one. On the left-hand side, we see here that this is the high-level overview, the macro view of all of those 18 identifiers and their red, yellow, and green status. So someone can very quickly look in here and see that an individual has transportation insecurity. So you're on the clinical side and you're looking at this and you see that the LIB has financial insecurity and you want to match him with resources that are available. You can click this button right here. It says Kynect Resources, and that will automatically bring you to LIB's patient profile within Kynect Resources. So you don't have to log in again. You don't have to search for the patient. It will automatically jump to his profile. And then from there, you can immediately start matching him with resources. So this is how that would look. So you've jumped over, it brings up LIB's profile, and you click on Create a Referral. This is the screen you're going to get, and you can search for different organizations, different locations, different resources, and hit Submit, and it sends that referral directly to that community-based organization where that representative receives that, and then they can reach out to LIB to start matching them to the resources that they're needed. Also, there's a lot of resources logged in here. If you just want to go look and see what resources are in your area, or maybe if there's resources that you're aware of that aren't listed in your area, you can make them aware as well. And so you can just go do general searches without having to be working with or on behalf of a patient. Okay, to close this out, this is kind of some of the impact of the collaboration and the opportunities that we have. So we have a lot of data. We already have a lot of SDoH data. So we're really working to make it more actionable and link that data and the individuals to those community resources. This will help with the triple aim of improving patient health outcomes, improving population health, as well as the healthcare cost efficiency. And then kind of what we're looking towards as the next or the continued collaboration efforts is we're always looking to increase the awareness of Kynect resources and this SDoH program. But we really want to do a lot of work around helping to identify resources and performing appropriate analytics on that data. So we were talking earlier about needing additional community-based organizations and needing additional services as this is going to expand and grow. But how do you know what's necessarily needed? As you all are starting to code and send this information in, we can aggregate that information and we can tell across the state of Kentucky what are the needs and where that needs to be driven. And that can go directly back to the legislature to say, okay, this is where we're at we're seeing that the largest need is in transportation. And we have proof right here from our clinical encounters that show that transportation is the highest need. So that's really the direction that we're moving towards. With that, here's my contact information. I am at time, so I will be at our KHIE booth and we'll be here throughout the day if you have any questions. Also, we weren't able to do a live demo of the kind of switch between the systems, but if we have the capability to do that, we have our laptops and we can do that if you're interested to see that at our table as well. So, thank you.
Thank you, Andrew. That's really good. A lot of great information there on how to utilize KHIE. All right, so before we break, we have one more award. This is the Diabetes Learning Collaborative Suite Success Award. And just so everyone's aware, we partner with the Department for Public Health, the Chronic Disease Branch, on a lot of different grants. And so as we talk about the Asthma Award or a Colorectal Cancer Screening Award, or a Hypertension Award or this Diabetes Award, that funding comes from the CDC through Public Health. We're working with Public Health on being technical advisors around the EHR. So we really appreciate Public Health support in all of these initiatives and helping, provide that better care, better outcomes, and being able to provide those resources. So we do really appreciate their support. The Suite Success Award goes to Mount Sterling Clinic. So congratulations. And Sandy and Donna Cassidy come up. So Mount Sterling Clinic is a small practice in Estill County. It has 3 providers, and one of which is currently participating in the Diabetes Learning Collaborative with us and the Kentucky Department for Public Health. They have currently served nearly 2,500 patients in their rural practice. They have made strides and improvements with all of their measures within the program, nearly surpassing all the goals ahead of schedule and achieved while learning their newly implemented EHR software earlier this year. This clinic's strong desire for their community of patients and their health outcomes is a driving force in their success. Congratulations to Mount Sterling Clinic. Thank you. All right. And now we're going to break for my favorite part of the day, lunch. We have DeRay's Catering. It is set up in the back room back here. So we will are we going that way? Okay. So go to the back door and we'll come back out through this. So we'll make the big loop and come back to your tables. We have our next guest speaker at 12:15. So we're going to start back fairly quickly. So just in about 30 minutes. So appreciate everyone's attendance, and we look forward to talking to you again at 12:15.